Hey everyone, welcome. And we are doing a special episode for this week. Have a couple wonderful ladies with us from Shriners Children's of Ohio. And just about Shriners, if you don't know about them, they were the 2023 Virtual Bloom sponsors of our Dayton and Cincinnati virtual dual market Bloom. And they were a Bloom Expo exhibitor in our Cincinnati expo that we had brought back after several years of not having an in-person one. So thank you again for interacting with moms and sharing there. But located in Dayton now, Shriners Children's Ohio's experienced and compassionate team brings hope and healing through their pediatric specialty care. And our special guest is Chief of Staff Dr. Higginson and Jessica Wagner. We're going to talk about Burn Awareness Week, which is February 4th through the 10th this year. So Dr. Higginson and Jessica, welcome.
Hi, thank you.
Yes, thank you.
Very excited to be here.
Yes. So Jessica, you are in marketing, right?
Correct.
Yes, and also a Dayton native, I heard.
Yeah. So I grew up in the Dayton area and intentionally chose to move back here once I finished college because it's just such a wonderful community.
That's awesome. And then Dr. Higginson, you come to Shriner Children's in Dayton from the University of California, San Francisco, Fresno, where you were director of burns at Leon S. Peters Burn Center.
Yes.
Right? The only comprehensive burn center in the state between Los Angeles and Sacramento. And you know Ohio, right?
Yes, I went to the Ohio State for medical school.
Yes. And for anybody
locally.
Yes, I was gonna say my best friend lives in Columbus. Anybody that's watching this that doesn't know about the Ohio State University, the B is very important. And so you grew up in the Los Angeles area,
Yes.
graduated from the University of California in Los Angeles. You taught high school science for a few years.
I did.
And then, since your youthful aspirations included becoming a naval officer, you enlisted, and the U.S. Navy trained you to fly the SH-60B Seahawk, a helicopter that can land on ships. Super impressive when I was sent this. Then, following your naval service, you became an EMS pilot for MedFlight of Ohio. And then it became apparent to you that you really enjoyed medicine, particularly assisting trauma patients, and that led you to Shriners.
Yes. It's a long and winding road, but I get better every stage of life.
Yeah, very, very impressive background, career. Thank you for your service and all that you've done for the country, and now that you are doing for parents in the Southwest Ohio area. So do you want to tell us what your title is at Shriners?
I am the chief of staff of the hospital. So along with being a burn surgeon and really treating children kind of internationally and kind of the Midwest to East Coast of the United States, which is very exciting with Shriners. I get to help with the other services that we provide and make sure that we're all running effectively. So under me is also not only the burn program, but our cranial facial program, which is very exciting. So where those are our two major points of focus here. And again, my first love, yes, was trauma. And then a niche in that is burn, and being able to do pediatric burn. This is truly the best chapter so far in all of my adventures.
That's amazing. So we did have a handful of questions for you, so we get your expertise and around burn awareness. So the first one is to tell us more about what made you want to become a physician.
At age 18, I think it was something to do with, a bunch of us friends got together and we made lists, all the things we wanted to do before we died. And my list had all sorts of things on it, bungee jumping and, skydiving. But I definitely had a list. I wanted to be a naval officer. And I wanted to be a physician. I wanted to be a pilot. And so, It just as these opportunities appear. But while flying for MedFlight Ohio, which was amazing, landing on the side of the road, taking a patient who's in extreme distress and delivering them to a hospital, and seeing the trauma surgeon show up and just kind of work their magic and make everything happen. That was truly my path to medicine. I thought, now that guy has a cool job. And yeah, all the way through medical school too, everybody's like, oh, you're not going to want to be a surgeon. They're horrible people and you're going to pick something else. And clearly those horrible people are my people, trauma surgeons and burn surgeons. I mean, it's an opportunity to meet someone on the worst day of their life and make it better. And so it's kind of like I get to be the hero often, and I love it.
Yeah, yeah. It sounds like, yeah, you've been very heroic throughout your whole life. So, yes. All right. So, why did you choose burns as a specialty? If you can go into that more, and ultimately, why did you choose Shriners Children's?
Burns is very kind of there's an art to it. There's not just one way to close a wound, to graft a burn. It's very arts and crafts. I crochet and quilt, and I just brought that to surgery. The way that you place skin is very artistic. It was the opportunity in trauma to continue to treat children. It's the one specialty in adult trauma where you keep all of the patients, from the very elderly to newborn, and the opportunity to continue to do that. Now, coming to Shriners, I spent a lot of years trying to push for what I thought the patient needed. And having to think about, they need it, but this is cheaper, or it is, to change the look of a burned child's face, and to have an insurance company tell me that it's cosmetic and unnecessary and that they won't pay for it, and beating my head against that kind of insurance company wall, to say that it's so much more, it's life changing, and to come to Shriners and be surrounded by the support of this organization, where the only question is, does the child need it? And regardless of a patient's ability to pay, any of that, none of that matters. It's truly, do they need it? And there isn't that moment of judging, this is more important than that is more important. To participate in giving a child the opportunity to have their very best life in the very best way that they can do it. That's what coming to Shriners in Dayton has allowed me to do with my career. And so truly, in all the things that I have done, I have leveled up coming here, because the delivery of care is amazing. And being able to deliver that and never have a conversation about pay or insurance, or to have volunteers that drive patients multiple states over so that they can attend their visits with me completely out of the goodness of their heart, just blows my mind. It seems too good to be true when you talk about it, but truly experiencing what the Shriners mission is, and its delivery of care. And so, and then the arts and crafts. Again, I like to quilt. I get to bring my artistic, vibe to make the outcomes. A child that's burned will forever be changed. But if I can make that the most beautiful, most functional scar that ever could be, then that's why I show up to work every day.
Oh, so you make me tear up a little bit as a mom. I'm like, is it going to start falling? Okay. Yeah, you guys do wonderful work, and it's really exciting that you're chief of staff now to continue to lead that vision. So next question was, what are the most common types of burns among children at various age ranges?
I think when you're kind of school age and down, it's scald injuries. And I think with the very young, it's usually a scald injury that occurs either bath time, sink injuries. hot water heaters being set too high, rental properties where you don't have control over, let's say you're in an apartment and you're 4 apartments down from the hot water heater, and the 10th apartment down, for them to see hot water, they've got to crank this hot water heater all the way up. And so your apartment sees horribly scalding temperatures on the water, but that further away apartment doesn't. Those are the things we see: scald injuries, accidents with hot beverages and hot soup. And as children age, we do start seeing more flame injuries and the like. So very young children have very thin skin. And so what may not create a burn, like we've all spilled our cup of coffee on ourselves, but a cup of coffee is hot enough. Starbucks is serving you a 160-degree cup of coffee. If that were to spill on you or a small child immediately, it can create a full thickness injury. And so those are the things we usually see with children, are scald and kitchen accidents as well.
Okay. What are some things that every mom should know about burn injuries?
I think when you initially have the injury occur, I think it's very important to cool the injury. So removing all clothing, if it's a flame injury, to extinguish the fire, the stop, drop, and roll. But once the fire or the source of burning is removed, remove all clothing, and under just tepid, cool water, not icy cold, cool the burn injury for 20 minutes. And then dry dressings. And if skin is coming off, if things are being removed, you can always put nonstick dressings. And if you don't have those, you can put a little bit of like cling wrap and then dry dressings, which will prevent any sticking or further pain. But cooling the burn for 20 minutes and then keeping it dry. No ice water. What that does is pull blood flow away from the skin. And so with less blood flow, you can have a burn that was not that deep convert to a very deep burn. And so you want to cool it, but you don't want it to be iced. And then seek care, obviously, at Shriners, Ohio.
Obviously.
I always am still, the ice, not using ice or ice water. I think it seems so counterintuitive because initially you think it feels good. And then hearing, Dr. Higginson and others talk about how it actually makes it worse. It's like, oh my goodness. But I also like what Dr. Higginson too, saying that about seeking us for care. There's no threshold of like how bad your child's burn is to go see Shriners. So, we're looking at the very teeny tiny burns to some of the more, critical cases or a larger percentage. But if your child had a broken pinky, you would want them to go to the best place to get that, fixed. And so it's the same with burns. And so we want to make sure that there's no burn, that parents know there's no burn too small. Because you may, depending on where it is, like she was talking about, someplace else may consider a laser procedure, cosmetic to reduce that scarring. And for us, for Dr. Higginson, like she said, she doesn't come up against that wall. It's just what's needed to make this area more functional and more cosmetic. She really is an artist. All of our surgeons are like artists because they care a lot about both the functionality and how it looks, because we all know we feel our best when we feel good about ourselves. So there's so much great there just to unpack a little bit that Dr. Higginson shared.
Yeah, that's great. And I know you've touched on it a couple of times about, they're like, oh, it's cosmetic, but that might be different if you were, an adult where how to handle social things, or, you have more confidence built up. But
I think even with adults, there's something you face, you want to be your best. And we're not talking about a normal progression of aging. When you have an itchy, raised, lumpy scar, face, hand, we have kids that want to play the guitar, but their fingers don't bend the way that they should bend. Those are things that we can address with the laser. Yes, the fingers will look better, but it's the, the ability to use them that is also improved. And some of the things that we don't think about as being burns, but truly are friction burns. So there are accidents around the home with treadmills and having small children fall and create these friction burns. There's falls off bikes and skateboards where you get a road rash or other injury. And again, we will address all of those as well. And I think, when you think about all the many ways that we can have scars, even if somebody else were to treat it and you're in that phase of, my child has this scar that bothers them immensely, be it itching, color, discomfort, we can see you after the fact of healing to try and figure out how can we optimize function and essentially cosmetic outcome.
Yeah, that's really great, because it's not, I was wondering, I'm like, it's not just how it looks, but how it might make them feel. I've only had a couple burns in my life, thank goodness. But yeah,
And you felt how much it hurts, that little tiny area.
Yeah.
The is obscene.
Mhm.
And so you multiply that by quite a lot when it's a big burn, and then a small child that can't reason through what's happening. So some of the other beautiful things we do have mental health, we do have therapists, we do have, rehabilitation to get them using their whatever their new outcome is, the best that it can be. So that's another reason to seek care at a burn center, be it this one or another one, is all those layers of people that specialize in various parts of the care are there. So once the wound is closed, even for children, as they have their growth spurts and their changes, you get burned as a 2-year-old. It's a very different injury when you have a growth spurt at 16. And now the finger that did bend no longer is bending. And so those are the beautiful part about establishing care at a burn center, and especially, a Shriners Burn Center, where we hold on to patients and have them coming back all the way until they age out.
Yes, very nice. You did mention that no burn is too small. Can you go into a little bit more on that?
Yeah, well, Dr. Higginson, do you want to talk to? I wanted to mention the other kind of burns we see at times too. I mean, scalds, like what she said, definitely are most common burn we treat, but the contact burns too. So the hot glass fireplace. I don't know if you want to address some of those, Dr. Higginson.
Well, I think that is important. Again, you said, if you break your pinky, but try to make a fist without your pinky. And so if you have a burn where your pinky won't straighten, it affects kind of functional outcomes. There's a lot of palm of the hand injuries that can cause the inability to fully extend the hand, the fingers. So those are big burns in toddlers touching the fronts of fireplaces or touching stoves, where they actually end up needing quite a bit of reconstruction to have their hand be functional. And, if it's a small scar, it can still affect whatever it is the child wants to do, be it play the violin or palm a basketball or wear shoes, without the top of the shoe rubbing on this large scar that no one ever sees. So why are we working on it? Because, it affects. You've had a blister on your foot. Now you can imagine having something permanent that bothers you that way. And so I think seeking out the best care, and maybe you thought, oh, this will be fine, it'll heal. And now you're like, oh my gosh, it's a big lump. I can address the big lump. And so, whether it's the size of a quarter or it covers 90% of their body, they're all important. I think we all have our own individual kind of trials. And there's never a point where we'll look at a child and be like, why are you here? We're only treating, no. It's how can we optimize the function, the look, that very small burn in a critical area, or something that is so distracting because it won't stop itching. That's a lot of problem with scars, is that they become just these sources of persistent itching. If we can alleviate that with a couple laser treatments, then you have a child that can now focus on reading and, pay attention in school. So that's truly, we don't want anyone to feel like, he's got to or she's got to get over it. It's not that big a deal. That is not how we approach this. If there's something that we can change and optimize, we will. And, that's kind of some of the other services we provide as well with craniofacial. There are quite a few things that change a child's whole outlook on how they feel about themselves if we change the way their ears look. Two very big, they won't survive without having, their cleft palate, that's extensive, repaired. We do quite a lot of surgeries that may be deemed purely cosmetic or won't be covered. Breast reduction surgery. I think, as women, we can understand what it is to not like our body, but to have breasts so large that as a child, you can't participate in sports, you can't run, you're just limited in the clothes that you can purchase. And so those are the things that's very exciting for me at Shriners, is that we can do breast reduction, we can do, address changes in ears, but also, the burn scars, the acute burns. And so there isn't, essentially, bring us what it is that's bothering you and let's talk about it and see, can we make it better?
I love what she said about the ears. So that's called otoplasty. So it's the ear sort of reshaping. So if your ears kind of stick out, that's typically considered cosmetic by most insurance companies. It's a super, from our surgeons, you see how skilled Dr. Higginson is, but our plastic surgeon's also the same. It's a very simple procedure. And it just makes a huge difference in that child's life. So I can speak sort of anecdotally about families that choose to share that. And, girls who they play sports and they've always run or played volleyball with their hair covering their ears, right? Never having it up out of their face. And then, now they're smiling and that family, even if they have insurance, don't have insurance, it doesn't matter. So it's things like that, or port wine stains or other sort of birthmarks where maybe your family or primary care physician could remove it, but it's on your child's face. And like you said, you've got the artist here of surgeons who can really make sure that scar is as minimal as possible. And to know that we're always there. So as that child gets older, and maybe the pigment changes, she can go back in, and I assume zap it with some sort of laser would be something like that she would do.
There are multiple types of lasers. There are
I know.
vascular ablative lasers. There are, the fractional CO2 laser, which, some of your listeners may be familiar with laser clinics where you can do a facial resurfacing and, work on wrinkles and everything, or the way that I use it, which is far more aggressive. But I actually remove some of the scar in parts, and I can change the way that the entire scar moves, the height of the scar, the way that it feels. So, it almost, until you get into it, or you have a child injured, or you have, a family member injured, you don't realize that these things are options. And so, I'm super excited for the opportunity just to discuss the many things that we do and address, because it's there's definitely preventing the injury, but once the injury has occurred, does that have to be a devastating, life-changing incident, or can we go back to our normal, this is something that happened and now I've recovered?
Yeah, and you talked about the prevention. I think that was our last big question, is with Burn Awareness Week coming up. Shriners Children's Ohio puts a lot of focus on education and prevention. So what are some of the most important safety tips that you'd have for moms out there?
Because I have seen so many injuries with hot coffee. I have no small children at home. So I have this cup with no lid, but I would say move to using travel mugs, not only because your child is going to distract you and it's going to take you forever to get to the coffee and it won't be hot anymore, but if you use a travel mug that has a lid on it, even if it's knocked over, the amount that's spilled is minimal. There's no toddler going to reach into the cup and come away with a dip injury. I've had breastfeeding mothers fall asleep while trying to sip coffee and have it spill on the child. And so those are things to think about. Is life is busy and it's hectic. So how can we minimize things that happen? So I would say travel mugs for your hot beverages. Pay attention to the level of your microwave. If it is above your head or above your child's head, and you have them, say you have a 10-year-old, a 12-year-old, and they're independently taking things out of the microwave, if they're pulling it down from above their head, the incident of having a spill, a slosh, or a pull down is quite high. And so the opportunity to pay attention to that. Some of the noodle cups that are kind of tilted such that, they tip over easy, transferring that to one of your own bowls, using a table, not sitting on the couch to watch TV because there's a lot of spilled injuries there. Using the back burners on the stove, having a safety zone in the kitchen, especially holidays where there are people visiting and there are more people in the house, making sure that small children are out of the kitchen, kind of a 3-foot zone. If you have a fireplace that doesn't have, there's like new glass that doesn't get hot. You can have wood burning stoves that the actual glass now, you can upgrade to that. You can put something where a child cannot get within 3 feet of it. Outdoor fire pits, if they're above waist level, the incidence of falling in them is much less. So you've seen some of the new fire tables. You're less likely to have a child fall completely in it, and then having a bucket of water, keeping them 3 feet from sources of heat. I'm giving you kind of the major, what do I see? They fall into fire pits, they run across coals that are still hot, being on beaches where fires have been put out and they put sand over it, that stays very hot. So paying attention. I've had quite a few injuries where children will just be walking on the beach the next day and walk right through an old fire pit and sustain some pretty deep burns. Falling into fire pits. Hot coffee is a big one. Noodle soup is always a problem. It's just consistent. So it would be, paying attention to how they're bringing it out of the microwave and what they're having it in. And then again, knowing what to do when the injury occurs and seeking help immediately, because what doesn't look like a terrible burn or a bad burn can actually be terrible. If it becomes infected, it will convert to a much deeper burn than it would have been had it not become infected. And so I think the cooling for 20 minutes, dry dressings, you don't need to try and come up with anything to put on it after that. And then seeing your pediatrician if you think it's, can totally wait and their pain is controlled, or coming to an emergency department and then being transferred to a burn center.
And to add on to that too, so with the calling for Shriners, your pediatrician could make that referral, or you as a parent can. It is not required that it's some sort of your physician or provider makes that referral. So any family can call us. And I was thinking another that I've seen, contact burns with flat irons and curling irons, particularly if you have kids with multiple ages. And again, we've had, families willing to share their story, and it was the 14-year-old girl, right? Used her straightener before school, had it unplugged, but the cord was dangling down. Little brother, reached up and grabbed it and, burn on the palm. So I think even that, when you've got multiple age ranges there, and those toddlers, man, they're fast, like little ninjas. They get into stuff.
Yes, they do. Yeah, and those are, bringing back lots of them. Like, man, there is a whole lot of things that can burn you and burn kids really badly.
And those aerosols. So this year with Burn Awareness Week it's flammable liquids. And so you think of the obvious ones like gasoline, but even sort of your aerosol hair or beauty care products, nail polish remover, again, particularly if you're in that age range with teen girls who want all their candles lit and want to do their nails, and it's just a disaster.
That's a big thing too, is open candles, open flames. I have had every age of child burn. You think she's 17, she's not going to set her nightgown on fire, and that's just not the case. So paying attention to, maybe battery operated candles, diffusers that don't use open flame. I have seen just every type of burn that a candle could cause, be it, burning down the house to catching hair on fire, catching loose clothing on fire. And hot appliances around the house. If you think of all the various things that get hot, even a crock pot sitting for hours can be quite hot just to touch the outside. But also if the cord is dangling down, you can pull the entire thing down. So moving everything a certain distance back, and then creating zones of safety where your smaller children just are not allowed to go.
Yeah. And I have a 14-year-old now daughter. So it is
take all these candles back.
Oh my goodness. And she loves candles. I mean, because we like candles and we like the incense and the diffusers and all that. But we had to tell her after last time, we're like, if we go into your room when you've left for school one more time and there's a candle or tart burner or like something left on, it's out. And she thought we were playing, but like she has a cat. And so like the cat, is
danger.
And she had like during Halloween, it's like, and it's older too. So we try and keep an eye on it, but it's a Mickey Mouse jack-o'-lantern like light thing. It's like this plastic light thing, but it's older, it kind of gets warmer with the bulb in it. She had like thrown clothes on top of it, like left. And I'm like, no, like I thought we made it through the toddler in the early years. Like this should not be stressful, but it still is.
But accidents happen, right? 99 times nothing happens, and then it's the one time, something does. So yeah, battery operated.
Yeah, that's what we're like.
And there are quite a few new products. You can get all of the Bath and Body smells through, there are melters that are plug-in that have safety off. So after 2 hours, they turn themselves off and kind of those things. But it's open flame is just a no-win situation, I think, on many levels. And I think we've all had moments where, you go to work and you're like, did I leave that on? Is that, there's a reason that every flat iron has an automatic, turns itself off, because everybody forgets, and so if you can eliminate the number of things that don't have a safety backup, you're winning.
Yes. So much to think about.
Not back in the old days with like giant Aquanet, like just spray and the curling iron that went to 500. Yeah. 500 degrees Fahrenheit to get your Farrah Fawcett waves. But
ooh, yeah.
Yeah.
Yes. Yeah. Still so much that we have to look out for. That's awesome. Well, yeah, this has been really good. Any final thoughts you can think of to leave us with?
I mean, I really would like to encourage anybody that if there is something that they're curious about, if they want to be seen, they can give us a call. They can come by our clinic. Old scars, new scars, small burns, big burns. And our cranial facial, one of the things we didn't talk about that I think is important to talk about, especially if you have new moms, speaking of head shape and plagiocephaly. One of the things that we do are helmets and different helmet fitting to help improve the shape of a child's head. But also in that, we screen for any reasons why their head may not be the shape that it should be. And so if there's something that we have 3 plastic surgeons and a neurosurgeon. And so we do some fairly complex cases with our plastics. And so those are things I think that's one thing that we didn't talk about is we will reshape your child's head. But we will screen for different things going on that your pediatrician may not have caught. And so if anyone would like to be seen or further questions, they can give us a call.
Okay, great. Yeah, and I'll make sure to put in the description links for everything, phone numbers, all that.
Perfect.
So parents are able to be able to reach out to you. So yeah, awesome. Well, I really appreciate you spending some of your evening with us and taking time to share. And yeah, it's really good to meet both of you. Really excited about you, Dr. Higginson, joining the team there. So good things to come.
Awesome. Thank you so much for
thanks, Courtney.
Yeah,
this was great. Thank you.
All right. Thank you. Thanks so much for tuning in. If you like this content, make sure to click the like button, share with a friend, and hit the bell to subscribe and be notified when we have new stuff to share. Doesn't cost anything, so why not?
She would rather be like helping kids, like in surgery.
Exactly. My crazy story goes over real big with the toddler crowd. They love me.
I thought you were gonna say it goes.
The toddlers are like, yeah, I like get into this.
It's amazing.
Makes weird noises. Let's keep her. Would like me to be full adult all the time.
That's what she needed to get into peds. That she was not getting the appropriate appreciation for her crazy eyes.
Adults love
working with those adults.
Crazy. You have your surgeon walk in and go, "We are going to take out your gallbladder today." Like, yes, I like her.
Oh my goodness, yes. My mom would adore you because she's the type. She's like, you should always embrace your inner 6-year-old. Don't ever.
Yes, right. We beat it out of you in the school years. Everything is not cool, and you got to bring it back.
Yes, we need more of that in our lives.
And the next time you drop your 14-year-old off, crank some 80s song and holler out the window how much you love her while she's walking into the school, unless she makes you drop her off 2 blocks away.
And the middle school and high schoolers get to take the Metro bus.
Oh, nice.
Yes. I know. So she and like her friends in the neighborhood, they they get to ride. They had the option this year for the 8th graders is like, you can do the yellow bus or you can do the Metro. And they were like, we're going to do the
That's
big
a good experience, right? Depending on where she goes next. Like, get that public transportation.
I think you should sit behind her a couple rows and be like, hey.
Yeah.
Well, her first day of school. So I've always, ever since preschool, we do the sign. And we do your first day picture, and then we do the last day picture. And I told her, I'm not stopping that. Like, I don't care. Like, as long as you're in school, it's happening.
Love the first day picture of like the younger kids, and then the end of day first day picture where they just look wrecked. Like, what happened? Were you working in the fields? Like, why are you so messy?
Yeah, those are entertaining. So for this year, because she was like, Mom, I'm in 8th grade. You're not. And I was like, oh, no, I'm doing it. And we're doing it in front of the school. And she was like, why? And so I told her, I said, I'm dropping you off to school because I'm going to take your picture with your sign in front of the school for your first day. And so we got out and she was like, this is so embarrassing. And then a handful of seniors were walking by like afterwards and she was just mortified. But a couple of the girls were like, oh, I'm so glad your mom still does that. And
I
was like,
vindicated.
Appreciate it later.
I know, but the one senior admitted that her mom still does it, but she does it in front of their door every year. And so I was like, look, even, seniors still do it. And she was like, yeah, but can you like do it at the house from now on? I was like, no. But
you need to threaten some sort of public embarrassment. Like next time you catch the lit candle in her room,
Right?
Where she has to wear a sign or something, or she has to wear a shirt.
I mean, we told her that we were going to come up to the school, and because we know the principal really well, and the staff up there. We were going to go and like have them let us get on the speaker system and just be like, we just want to tell you we love you and we're so proud of you. And like, she was like, please don't ever do that. And we're like, well, don't make us.
Or like little kids, you pin the like they pin their address and name and phone number to the shirt in case they get lost. Like we're pinning this on you now. You have to wear that. She could probably just shadow Dr. Higginson and see like what happens when just in that split second. We'll put the fear into her.
I mean, we definitely have some stories and some incidences that just haven't ended well. And I think just having the discussion about it, and we've all had those moments, but yeah, there's something that happens to the teenage brain where they're listening. They just won't admit it until they're like 22, but they are listening.
I think that middle school age is worse because they want to be adults, but they're also like still elementary age. And I don't know what I'm walking into. Like, who are you today? Are you third grader or are you trying to be 20 years old?
I'm like, every day 20. Wait till she's going to get her learner's permit. She's 14 next year. She'll be driving a 2,000-pound steel machine.
Right. We're like, like this deadly
candle.
I know. I'm like, you're going to need to show me that you can like focus a little bit better before we let you have your permit.
I think the burns too is like, you expect your kids to maybe have a broken bone or something like that, sports injuries, but you just don't think about burn. You just don't think about it.
Yeah.
So
I really think it's something where we've all been burned in little small ways. Like I had so many little curling iron tags, it's one ear is burned, or you bump yourself, putting something in and out of the oven. They're very small burns. And so the impact of a much larger burn just escapes the vast majority of people, that it's such a life-changing event for the whole family. And so if there's a way that we can make that easier by talking about it, that's essentially what we'd like. It's very disappointing to see a burn that was not treated well. And so we do see that just with lack of care, our international patients, you will do these scar reconstructions where, yes, it's good that they are alive. But some of the recovery, their chin is stuck to their chest. The scarring is so severe. And so I think seeing a burn that hasn't been done well just really lets you know what we can do, when we're right there from the start. And then, truly our plastics guys, I would love for you to talk to them, because one of our plastic surgeons actually invented a helmet, which is a fourth of the cost of what you get at most places. And again, we will cover the cost if you're being treated at Shriners, but the things that he can do, truly magic. I mean, they are moving. We have to show you before and after pictures of what they are doing. They are moving children's eyes around. They're moving the bones of their face. They're adjusting jaws. They're changing the whole shape of their head. Some kids whose cranial vault fuses while they're still very young, their brain can't grow in that tight closed space because their skull is no longer growing. And our team moves, changes, and allows them to grow and develop. And so if it's something that you think about and it would be interesting, I think our craniofacial team and being one of the few craniofacial teams with a neurosurgeon would be a really interesting conversation, because there's quite a few birth screening that we do, and there's quite a few genetic counseling and different things. I think that would be another aspect that goes poorly treated, where parents think they have to accept something as minor as I think, because I think it's 40% of births have a misshapen skull.
Yeah.
And so, you think, well, this is what I got. He looks like me, but I think those are the things. So if that's something in the future, I think Jessica can definitely connect you with our plastic surgeon team. And we very much, it's partnerships among multiple institutions truly that devote part of their practice and time to Shriners because they believe in our mission.
Yeah, I think maybe heading into later when it's like Cleft Lip and Palate Awareness Month, because I believe CDC is 1 in every 600 births in the US is some sort of cleft condition, which blew my mind because I don't know anybody in my life personally that like has a cleft lip and palate or one or the other, but it's really common. And so she's talking about kind of the extreme cases, but sometimes that's comforting to the family, because to us it may seem this is a small cleft or whatever, but for
well, and the surgery has come a long way. I mean,
yeah.
I can remember I went to high school with a young man. He forever talked different. You could tell the way that his nose and everything. We have kids now, and they do a commercial with them, and you're just like, why is that child on this commercial? It's like, you can't even tell we did anything. Like, the magic is just, we've come a very long way, and what we're capable of, I think would be for new moms to hear the things that we're capable of doing, I think would be pretty great.
Scan the QR code to be taken to our site and see all the new stuff that we put out every week.